Hi everyone, my name is German and I am a nurse practitioner here in city of Santa Clarita. I have just opened a weight loss clinic here in the city and I thought to offer also some educational material because I actually see many of the chronic conditions that our patients suffer very relevant to the topics that are involved in weight loss. The biggest umbrella is the metabolic syndrome. So I thought I would just bring you a few pointers about what metabolic syndrome is and what is it that you have to be considered a patient with a metabolic syndrome and why is it important. So basically a metabolic syndrome is like an umbrella of conditions that if you have them increases your chances of diabetes and heart disease. If you have three of these components, one of them is elevated waist circumference, which means that if you have a large waist and if you have bad cholesterol, especially if your good cholesterol, the HDL, is low and your triglycerides are elevated, it's considered dyslipidemia, basically bad cholesterol, high blood pressure, and elevated fasting glucose levels. So if you wake up in the morning and you haven't eaten anything yet and you check your sugar, and your levels are anything above 100, it's considered elevated fasting blood glucose. So if you have three of these conditions, you are considered to be having the metabolic syndrome. And again, as I said, the risk factors are that you're more predisposed to diabetes and heart conditions. So what are the risk factors? What are the risk factors of metabolic syndrome? It's hypertension, so high blood pressure, dyslipidemia, raised fasting blood glucose level, including insulin levels, and obesity. These are risk factors. Sometimes uric acid is also included. If you have high uric acid levels in your blood, it could be indication that there's some chronic renal disease, some heart disease, and as well as diabetes type 2. There are many things involved in this. So some of them you can control and some you cannot. Like for example, genetics. You cannot control your genetics. You have what you're given. So if you are predisposed to, let's say, diabetes or high blood pressure genetically, I mean, there are a lot of things you can do to prevent or at least control it, but the chances are very high that you are highly predisposed to actually getting those conditions. So another factor that you really don't have much control over is the fetal and neonatal programming. Basically, this is when you're developing in your mom's womb the conditions that you're exposed to. For example, if your mom was able to have a good pregnancy, if she was taking vitamins, or vice versa, if the conditions weren't appropriate for a developing fetus, let's say if mom drank alcohol or there were some drugs involved. All of this affects a person's health in the future. Again, there are many things you can do to actually fight or counter these issues, but I wanted to bring that to you so you know there are things that you can and there are things that you cannot control. Some the things that you can control are actually a lot. For example, your food habit, your social conditions, your food habit, you eat healthy or not, are you active, do you exercise, are you sedentary? All of these are factors that actually do affect your health, and especially those chronic conditions. Why? Because there are hormones involved. There are things that happen cellular level in our body that show as a disease later on when they're not taken care of. Sleep is another thing that is very important for you to consider. Everybody knows that sleep is important, and most people say you should get, for an adult, somewhere from 6 to 8 hours of nighttime sleep. And that's because we have certain hormones that are produced at nighttime when we are sleeping that are needed to regulate some of the functions of the hormones that are produced in our body. So if we have sleep apnea, or if for whatever reason we wake up multiple times a night and we are not able to get that restful night sleep, we have not only somnolence and fatigue during the day, but also we are stressing our heart. So there are consequences. And then, so why is this important? What is metabolic syndrome important? It's basically an umbrella, as I said, that has many of the chronic conditions in it, especially high blood pressure, cholesterol, diabetes. All of this increases the chances of a person having heart attacks, strokes, or overall, it's considered cardiovascular diseases in the future. And we want to avoid that because I actually do see them in the emergency department when they come in. I still work as an emergency nurse, and majority that come in do have some sort of a heart condition, either suffering from heart attacks or strokes or overall heart failure, or things that are related with the cardiovascular system or overall circulatory system. One of the major things you can do to improve metabolic syndrome is weight loss. Why? Because weight loss literally touches everything. It does affect your sugar levels, it does affect your blood pressure, lowers everything because we do produce some hormones from our fat tissues that are involved in many of the inflammatory processes, which I will be talking about that in my next few videos. So things that are important to consider are basically what you're putting in your mouth, what you're eating on a daily basis, the diet, exercise levels, your activity level, things that you're exposed to through your job as also are things that you need to consider, chemicals, things that you're breathing. All of these does affect overall how your health will be in the future. But at least it's good to understand what metabolic syndrome is. And so at least you can take steps in managing at least one of the conditions that are falling in there, either diabetes type 2, high blood pressure, high cholesterol, even fatty liver falls in there, inflammatory processes are involved as well. Alrighty, thanks for listening.